Unfortunately, a growing number of people living with HIV who work have lost jobs and thus lost health insurance coverage. There are many more HIV-positive people who work at jobs without benefits and or are underinsured. People living with HIV are right among the other millions of people adversely affected by the national economic crisis and growing unemployment. Rising costs and rising client enrollment has placed a major strain on all program aspects of the HIV/AIDS section. HIV prevention program grants to local health departments and community-based organizations were cut by $7.5 million in fiscal year 2010 in order to meet demands associated with the spiraling growth of the ADAP program. Even supplemental and carryover federal Ryan White dollars previously designated for enhanced care and support services were instead used to cover rising costs for the ADAP program. Most recently, additional resources have been made from the governor's office to help us assure that in the immediate period there is no treatment interruption for current clients. Meanwhile, we continue to have an average of 105 new eligible clients each month added to the ADAP program. Federal funding for HIV prevention has remained flat. Ryan White federal dollars can only be expected to grow by 5% based upon the most recent 4-year extension of the program by the U.S. Congress. At present, there are fewer HIV prevention programs in operation around the state. Even the successful routine HIV testing initiative going on in 45 STD clinics around the state, yielding 313 new cases of HIV infection identified in calendar year 2009, is in jeopardy of being scaled back. Regional HIV prevention and care programs are experiencing cuts as we speak due to GRF dollars reserved to cover pharmaceutical bills that are now averaging $4 million each month. The leadership of IDPH and the highest level of state government has supported this program over the years and right now. However, the combination of great success with prevention and care, along with a national and state economic crisis, has formed a perfect storm. The strategy must emerge that does not interrupt treatment, that does not further erode HIV prevention, care, and support services. It must be formed and as quickly as possible. The fiscal 2011 budget approach needs to take into account the principle of no treatment interruption and no further strains on HIV prevention, surveillance, and direct services. HIV remains a disease that has biological and socioeconomic drivers. The combined power of science, advocacy, and passion has gotten us this far. We need to call upon those strengths and much more to move us forward. Thank you.